Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
I'm going to discuss today what you can do to help prevent future urinary tract infections if you're prone to them, and perhaps help take care of a current urinary tract infection. My name is Jerry Hickey. I'm a nutritional pharmacist. I'm also the senior scientific officer over here at Invite Health, and welcome to our episode D-Mannose for urinary tract infections. So women more prone to urinary tract infections than men. Eventually 1 in 5 women, 20% of all women, will develop a urinary tract infection. So obviously it's very common. Now, a urinary tract infection, it's an infection in any part of the urinary system. So it could be your kidneys, your ureters, which is the connection from the kidney to the kidney bladder, the bladder itself, and the urethra, which is the tube that you urinate out of. However, most of the infections in the urinary tract involve the lower urinary tract, just the bladder and the urethra. The bladder is this muscular sac that holds your urine so that you're not running to the bathroom every second, and the urethra is the tube out from the bladder. So the most common cause of a urinary tract infection is a bacterium that normally lives in your intestinal tract. It's called Escherichia coli. Most people know it as E. coli. That happens to be the same bacteria that certain strains in undercooked chopped meat is very dangerous to eat. But of course other bacteria as well can cause a urinary tract infection, but by far E. coli. Now, if you don't treat the infection, it usually doesn't get better. And if it reaches the kidneys, it could cause a problem. So the urethra is the tube that drains urine from the bladder. And women are more prone to urinary tract infections because their urethra is shorter than a man's. So it takes less time for bacteria to reach their bladder, making it easier for bacteria to reach the bladder, cause an infection. Now, some women suffer frequently with urinary tract infections. These are commonly recommended steps to help prevent a UTI. If you went to a medical website, so you can take these steps to reduce your risk of urinary tract infection. Drink plenty of liquids, especially water. That dilutes your urine, and it ensures you'll urinate more frequently, and you'll flush out bacteria with a stronger stream of urine. Drink cranberry juice. You're actually better off with cranberry capsules. Cranberry is extremely bitter and tart. It's loaded with polyphenols, and it's the polyphenols that do the job for you. The thing is that they add a lot of sugar to the cranberry drinks. So if you do a capsule, you get the same ingredients, and what it does, it makes the urinary tract more slippery. So it's hard for the bacterium to attach to the urinary tract. So when you urinate, the power of the urine flushes the bacteria out. There's a couple of hygienic things. Wipe from front to back. Doing so after urinating and after a bowel movement helps prevent bacteria in the anal region from spreading to the vagina and the urethra. It's an important thing because that's how the E. coli commonly infects women. After intercourse, empty your bladder as soon as possible. Drink a full glass of water to help flush out the bacteria, because you can get urinary tract infections during your intercourse. And some of those feminine products are very irritating, like the deodorant sprays and the douches and the powders. It can irritate the urethra, cause inflammation there. So here's what I recommend to women. Now, in fact, I just had a woman this week contact me. I told her to get a combination of cranberry along with D-Mannose and probiotic bacteria. But I also told her drink some hibiscus tea. Hibiscus tastes delicious. And if you want to mix a little cranberry in there and some white or green tea, that's good. Because hibiscus has a known effect of helping to cleanse the urinary tract. Probiotic bacteria, certain strains of lactobacilli, when you start to swallow them, within about a week they're reaching the urinary tract. And they start to make it harder to develop future urinary tract infections. It takes time, but also vaginal yeast infections. So when you take a probiotic bacteria, certain strains will actually migrate throughout the body. They'll wind up in breast tissue, vaginal tissue, urinary tract tissue. Now, D-Mannose. D-Mannose is a sugar we naturally make in our body. To infect you, bacteria have to stick onto the wall of your urethra. Taking a supplement of D-Mannose makes it a lot harder for this to happen because it makes the walls of the urinary tract extremely slippery, and it prevents the bacteria from sticking to the walls of the urinary tract. So when you urinate, the pressure of the urine flushes out the bacteria, helping to prevent an infection, and D-Mannose is probably the best thing you can take to help prevent, and it seems to be also to help treat a current urinary tract infection. So it's not just preventative of future infections, it may help a current infection. So the research shows that D-Mannose reduces the symptoms of a urinary tract infection that's current. You know, the burning, the increased urination. So let's look at some of the data. Let's look at some of the studies. This is a very current study, August 2020. It's in the American Journal of Obstetrics and Gynecology. It's from the University of Pittsburgh, a great academic research institution. Their Department of Obstetrics and Gynecology and Reproductive Sciences, and Washington University School of Medicine in St. Louis, and once again it's their Department of Obstetrics and Gynecology and Division of Female Pelvic Medicine. They looked at the total amount of data available now on D-Mannose. Does it help with urinary tract infections? So that's called a systematic review. So they went through these different electronic databases that collate research, like Ovid, Medline, Embase, Cochrane Library, Web of Science. So that's a systematic review. And then what they do is they go through all the studies and they see which ones fit their criteria. In this case, does D-Mannose have an effect on preventing future urinary tract infections? And then they get those studies together and they comb through them to see which studies are totally legitimate. They're well designed, they're well reported, they're lacking bias. So they found 8 very dependable studies lacking bias, high quality data, high quality evidence. And when you do a systematic review and meta-analysis properly, without having some bias behind it, it proves that something either really does work or it doesn't work. So these systematic reviews and meta-analysis from research institutions like the University of Pittsburgh and Washington University School of Medicine are actually very important. So 8 publications. The relative risk of urinary tract infection recurrence. Okay, so your urinary tract infection went away. Can you have another one? On D-Mannose, a sugar naturally made in the body, but you only make a small amount, so this is actually a supplement, reduce the risk of future urinary tract infections by 77%. That is huge. That's actually stronger than antibiotics. So then they looked at antibiotics, comparing D-Mannose to antibiotics. Antibiotics reduced the risk of future urinary tract infections by 61%. 61%. Whereas D-Mannose reduced the recurrence of future urinary tract infections by 77%. That's sizable. Of course, the D-Mannose was a lot safer than the antibiotic, because the antibiotics tend to kill off your good bacteria as well as the bad ones. So here's what they said. D-Mannose appears protective for recurrent urinary tract infections versus placebo, with possibly similar effectiveness as antibiotics. So in other words, come on, the research is right there. The D-Mannose works. And that's preventing a future urinary tract infection. So when women call me with that, I recommend this powder that has high quality cranberry, that has probiotic bacteria, and that has the D-Mannose all mixed together. So here's the journal Climacteric, and it's once again a very current study. It's April 23rd, 2020. It's the University of Pisa in Pisa, Italy, their Department of Obstetrics and Gynecology, and the University of Modena and Reggio Emilia, That's once again, Department of Obstetrics and Gynecology, which is what you would expect when looking at urinary tract infections that are more common in women. Now, this was women undergoing prolapse surgery, so there was a shift in their sexual organs. So here's what they said. These are women who are undergoing surgery for a bulging urinary bladder, so it's impinging on like the urethra, and they gave them a supplement of D-Mannose with cranberry and some polyphenols, antioxidants, to see if it would prevent complications like urinary tract infection, cystitis, and inflammation in the bladder and urinary tract. So it was 40 postmenopausal women. They took the supplement twice a day for 2 weeks before the surgery, or they took placebo. And what they found was the women on the D-Mannose and the cranberry, they did significantly better. They had fewer complications from the surgery. So the lower urinary tract symptoms connected with this surgery after menopause was really helped by combining D-Mannose and cranberry. So here's the World Journal of Urology. This is a study of 308 women who had a severe urinary tract infection. And they were developing recurrent urinary tract infections. They're prone to urinary tract infections. And they were split into 3 groups. So their urinary tract infection was healed. For 6 months, they put them on D-Mannose, or for 6 months, placebo, or for 6 months, nitrofurantoin, which is a very powerful antibiotic used to prevent and also treat urinary tract infections. So the women on the D-Mannose, or the women on the nitrofurantoin, of course, compared to the women who didn't receive either, did much better. They had far fewer urinary tract infection episodes over the 6-month period. The difference between them is interesting. The women on D-Mannose had fewer infections than the women on the antibiotic. It was actually more protective than this commonly prescribed antibiotic used to treat urinary tract infections and prevent future infections. Of course, the D-Mannose was a lot safer than the antibiotic. The antibiotic itself is not a dangerous antibiotic, but it could cause things like diarrhea, etc. So the D-Mannose had fewer complications. That's a good thing. That's a good thing. So here's the journal Minerva Gynecologia. It's University of Siena. That's a great journal, by the way, gynecological journal. And they're talking about, as women age, it affects their urinary tract, and it makes them more susceptible to urinary tract infections. Like with reduced estrogen after menopause, they're stiffening, cystitis becomes pretty common at that point. They also develop bladder inflammation. So what they did, they gave them D-Mannose. Now, this is 150 women, age 40 to 50, suffering with recurrent cystitis, with or without bacteria, because you could have inflammation in the urinary tract without bacteria also. And they found that the women on the D-Mannose, almost all of them, 92% of them, their lower urinary tract symptoms improved, and so did their lower urinary tract infections. D-Mannose is real. So here's the University of Sapienza in Rome. Once again, Department of Gynecological Obstetrics and Urological Sciences. It's the European Review of Medical and Pharmacological Science. And this is a study of women with current urinary tract infections. So we've already seen that D-Mannose is very effective in preventing future recurrent urinary tract infections. But what about if you already have one? So they found that absolutely D-Mannose helps you get over a urinary tract infection. But also they found that it strongly prevented future urinary tract infections. With D-Mannose, using D-Mannose, only 4.5% of women developed future urinary tract infections. But without D-Mannose, a third, that's a huge difference. A third of them develop future urinary tract infections. So the effects are real. Now, if you have a question on anything I've said, let me give you an email. It goes to 5 of my nutritionists, nutrition@invitehealth.com, and you can send them an email question. I'll give you my email also, jhickey@invitehealth.com, jhickey@invitehealth.com. Very interesting because, podcasts can be listened all over the world. So this morning, somebody from London was asking me about a podcast in an email. So it is valuable giving out the email address. So once again, to reach my nutritionist, if you have a question on anything with nutrition, nutrition@invitehealth.com. And for me, and by the way, there's no pressure. You don't have to shop with us. We're very friendly people, and we have knowledge, so feel free to contact us. My email address again, jhickey@invitehealth.com. So thanks for tuning in to our podcast at Invite Health, and you can find all the episodes for wherever you listen to podcasts, like even all the Apple platforms and iHeartRadio and all that. And it's for free. Or you could go to invitehealth.com/podcast. Please subscribe. Please leave us a review. You can also follow us on Facebook, Twitter, and Instagram at Invite Health. And I hope to see you another time on an Invite Health podcast. But especially thank you so much for listening.